Almost 4 years ago, Yurai was diagnosed with breast cancer. She underwent the usual surgery and painful radiation treatments. But now, the cancer has returned. She thought she had a few options left. Then she heard about Dr. Green. You've got a rather grim picture to paint. When this woman came into your office and you saw her records, what did you think?
Well, she came here having had surgery on the breast due to carcinoma, breast cancer, and then she'd had extensive radiation. And it's reoccurred in that unmagic time of 3 to 5 years. And when it does, the prognosis is usually not very good. And she falls within that. It's reoccurred on the other side now, and it's moved to some different parts of her body.
So when this patient walked into your door, what was her state of being?
Well, I think it was pretty typical of a patient that's been through surgery, radiation, and really put through the mill. She was very weak. She was not able to walk any distance whatsoever. She was on pain pills. She was on sleeping pills, narcotics of all type. And it was, of course, that's the way most patients in her condition are.
We're here with Kun Yurai and her daughter Kun Puki. You were diagnosed with breast cancer about 4 years ago. You went through all the traditional treatments, and now it's returned. How did you find out about Dr. Green?
Someone to invite me about Dr. Green, and I ring to call her, his wife, Kun Pon, and then she want to come to see Dr. Green and interview her about what kind of the breast cancer.
Okay. Now, when she first came here, how would you describe how she was feeling and what she was going through before you started treatment?
I think it's my mom is better if treatment and she not pain.
So she was experiencing a lot of pain before?
Yes.
And how much different is it now?
He's looking good.
Before the treatment began, your mom was in a lot of pain. She was having difficulty sleeping, we were told. And she couldn't move around very well. Now, after the treatment, if you could compare the two, how would you say she is right now?
She looking good, and she have a move to around, and she can cook. She have a walk, and not tired anymore. She's better.
That's very good. That's very good to hear. Now, how many treatments has your mom had?
This now?
Yes.
6.
It's only 6 treatments.
Yes.
And you've seen that big of an improvement.
I think it's okay.
And so you're going to continue with the treatments?
Yes, of course.
Dr. Green, I've spoken to the patient, and I am nothing short of stunned. This has got to be some of the best results that you could possibly hope for. What is her prognosis at this point now with this?
Well, I think her prognosis is pretty good. You know, I named this the Center for Longevity and Pain Relief because cancer is often like a bullet. You can remove the cancer and still lose the patient if it's done enough damage. So what I try to do here is longevity. I try to help them live longer, and pain relief with a better lifestyle. And I've been able to accomplish that. In fact, when this lady came in here, she was not able to sleep without drugs. She sleeps without drugs. She sleeps all night. She was not able to stand the pain. She's not taking pain pills anymore, and she's pain-free. She had a tremendous rash. The rash is subsiding. And she came in the other day, she says, well, I'm very sore here. And I said, why? She said, well, I think I exercise too much. So she's actually exercising now, and now she's starting to walk every day. So I think her prognosis is extremely good for the condition that we started with.
You've heard from Dr. Green and from the patient herself. Is this a medical miracle? Only time will tell. Has this treatment improved the quality of life for this patient? Well, most certainly yes. We're going to keep track of this patient's progress and report back to you at a later date to let you know how she's doing. In the meantime, if you would like more information about this treatment or any other treatments that Dr. Green offers, please visit his website at drgreenrct.info. Thanks for watching.